So what exactly is EMDR? And also, what exactly is the Virtual EMDR online EMDR program? These two questions seem to come up frequently, and there seems to be a lot of confusion about it. Let's take the time to break it down into simple terms that make sense. First, did you know that the American Psychiatric Association, the World Health Organization, and the United States Department of Defense have declared EMDR-type therapies as an effective form of mental health treatment? In fact, there are about 70,000 in-person EMDR therapy clinicians that have treated millions of people around the world over the past 30 years. EMDR is an acronym which stands for Eye Movement, Desensitization, and Reprocessing. Now let's have a look at exactly what that means. First, let's talk about eye movement. When EMDR was first started as a therapeutic approach in the late 1980s, it focused on using eye movements to repeatedly stimulate the left and right sides of the brain. Early EMDR therapy sessions were often done with no additional technology to help the therapist at all. The eye movements were completed simply by instructing the patient to follow the therapist's finger as it moved left to right, back and forth. This more simple approach does work to a degree and does stimulate the left and right hemispheres of the brain, but since those early years of using this treatment approach, it has been discovered that there are a lot more ways to do EMDR than just with the eyes alone. As EMDR has become increasingly modernized, treatments have started to include things like audio tones which move from ear to ear and can be made faster or slower, or even things like touch-based approaches such as holding small buzzers in your hands or tapping your knees from side to side and back and forth. Many in-person EMDR therapists use a combination of approaches to their sessions, such as both visual and audio stimulation at the same time, or maybe even audio and touch-based stimulation together. Even though EMDR is a lot more than just therapy done by eye movements, the original name, Eye Movement Desensitization and Reprocessing, stuck and is still being used by thousands of people in the therapy and mental health community around the world. At first, EMDR therapy was only used to treat trauma and post-traumatic stress symptoms. The therapy was often targeted at soldiers coming back from combat. As EMDR has grown as an accepted and effective therapy approach, therapists are now using EMDR for things like eliminating addiction symptoms, removing difficult emotions like grief and loss, helping people control overwhelming emotions, and the management of fears and anxieties. Here is the shortest possible definition of what EMDR therapy does. If you use EMDR while focusing on a distressing memory, the brain reprocesses, or you might even say digests that memory, and it no longer feels so distressing. Whatever the memory, emotion, or behavior that has become so troublesome was, it seems to lose its strength and fade into the background. It just becomes more manageable. EMDR works by reprogramming the way that your brain interprets traumatic memories, behavioral compulsions, and difficult or unwanted emotions. This changes the way that the neurons in your brain communicate with each other, a process scientists call neuroplasticity. While EMDR therapy has been heavily researched, scientists are not entirely sure as to why EMDR works so effectively. Some scientists think the process is somehow akin to the rapid eye movements experienced during REM sleep. And now that science is learning more about neuroplasticity, which is part of the brain's natural ability to change and heal itself, some scientists think that EMDR somehow reprograms the brain. Researchers have not yet isolated exactly how EMDR therapy works, but they know it works. There have been dozens of studies conducted around the world which have looked into the effectiveness of EMDR, and these studies have consistently come to the same conclusion. EMDR treatments effectively decrease, eliminate, or help people to manage their symptoms. The most famous EMDR study took 88 people who were suffering PTSD-like symptoms, including depression, anger, and emotional outbursts, and then randomly put them on either Prozac, a placebo pill which contained no medication at all, or weekly EMDR therapy sessions for 8 weeks. The results were pretty astounding. At a 6-month follow-up interview, those who were put on Prozac were experiencing no relief of their symptoms. They'd been taken off the drug 6 months earlier at the end of the 8-week period, so there was no Prozac left in their system to help them. On the other hand, of those who underwent the EMDR treatments, an incredible 75% of those with adult-onset PTSD still had no symptoms, even though it had been 6 months since they underwent treatment. The EMDR had changed the way that their brains had interpreted the trauma and PTSD, and the problems they were having were simply eliminated. One of the most important things to understand about EMDR therapy is that it is just not that complicated. Once you understand clearly your problem issue, a process which is called target selection, you can simply use the EMDR technology and let your brain do the rest of the work. It's almost as if our brains were designed to heal in this way, but we have only really understood this in the past 30 years or so. Over the decades, EMDR has exploded in popularity. Right now, there are EMDR therapy associations almost everywhere around the globe, including the United States, Europe, Singapore, Japan, Australia, and even in places like Argentina, Brazil, and Canada. So what then is Virtual EMDR? Virtual EMDR is a complete online EMDR program that takes EMDR out of the exclusive hands of therapists and puts EMDR technology directly into the hands of the people who need it. The Virtual EMDR program teaches you how to assess your problems and break them down into what EMDR therapists call targets. You will then learn how to use these targets, along with the powerful and programmable technology of the Virtual EMDR session tool, to produce physical changes to your brain's memory and emotional response center. Virtual EMDR guides users step by step through the entire EMDR process. It is exactly the same as in-person EMDR therapy, except sessions are completed at your own pace, as often as you would like, and in private. Virtual EMDR treats things like trauma and PTSD symptoms stemming from rape or sexual abuse, or things like war, child abuse, or traumatic violence. It also treats addictions such as alcoholism, drug abuse, sex and porn addiction, compulsive gambling, and compulsive overeating. Virtual EMDR can also be used for things like fear and anxiety problems, such as a fear of flying, fear of public speaking, or generalized anxiety. It is also effective with overwhelming grief and loss due to miscarriage, death, divorce, or the loss of a loved one. While in-person EMDR therapy can cost upwards of $200 per hour-long session, the Virtual EMDR program gives you full access, including as many sessions as you want, all for less than the cost of a single in-person EMDR session. Also, Virtual EMDR comes with a money-back guarantee, so if you find it is not working for you, just send an email to get a refund. One of the great things about EMDR-type therapies is that when they work fast, really fast. Patients who have reported that they have had little success with years of in-person talk therapy came out of only a couple months of EMDR treatments completely transformed. And volunteers who helped test the Virtual EMDR program reported that they could feel a difference right after their first session. So hopefully this clears up some of the basic confusion about what EMDR is and how it works. You can find a local, in-person EMDR therapist by looking online. And if you would like more information about the Virtual EMDR program, go to www.virtualemdr.com, where you can sign up for a free 3-day trial. Thank you for taking the time to listen.